Most men don't talk about prostate health until something goes wrong. I'm guilty of that, to be honest with you. But the truth is, what you eat, how you move, how you handle stress can change everything. So today we're sitting down with two oncology nutrition experts to break down the real science behind protecting your prostate, boosting recovery, and living stronger at every age. Now, this isn't about fear, but this is about power. The power to make informed decisions and to live longer and stronger lives. Welcome to the If You Are My Brothers podcast.
So we have a confirmation with a second opinion that he definitely has prostate cancer.
I'm Reggie Hicks, producer of the documentary and outreach project, If You Are My Brothers, and host of this podcast, the If You Are My Brothers podcast, Prostate Cancer Conversations. I want to welcome everyone watching on YouTube, LinkedIn, Facebook, and to those listening on your favorite podcast platforms. Later on in the week, we'll be dropping that on Wednesday. But we will be bringing on our two guests to talk about myths, truths, and what every man needs to know when it comes to prostate health in just a minute. But first, as always, a quick reminder that this podcast, again, is not a substitute for your medical team. Opinions and issues that we discuss are not a replacement for treatment. Always consult your healthcare provider for that. And remember, some conversations on this podcast can be of an adult nature, so we really ask you to listen accordingly as we journey together. Now, we call this series Prostate Cancer Conversations, so we invite you to join us. Join us in the chat with your comments and questions. Don't be shy. This is real life. And remember to like, share, and subscribe as we go on this journey together, particularly if you have someone that you know is going through recovery. Maybe someone has been recently diagnosed or in the process of getting ready for treatment. This was a wonderful episode to really talk about health and what you can do before, after, and during treatment. Now, to learn more about the podcast and the If You Are My Brothers documentary and community engagement project, we want you to please visit us at ifyouaremybrothers.org. That's ifyouaremybrothers.org. Now, that out of the way, I'm excited about this because this topic is something that's always on the top of my mind is how can I get healthier? How can I get better as a prostate cancer survivor and then having a reoccurrence of earlier this year, having gone through radiation treatments, 38 of them, by the way, proton radiation. I'm really concerned about how I can keep healthy. Right now, my PSA is undetectable, which is a good thing, but I have to go back every 3 months. And what I've been told is that radiation hopefully did its part. Now it's time to do my part. And that is make sure I can be as healthy as I can be, deal with inflammation, and really hopefully starve whatever may be left, because we're talking about molecules when we talk about cancer cells, right? So I'm happy to bring on this evening Valerie Buckley, who has been a registered dietitian since 2013 and has worked in oncology since 2017. She graduated from Emory University with a Bachelor's of Science in Anthropology and Human Biology, and she completed her Master's in Science in Food and Nutrition at the University of Georgia. Go Dogs, I tell you. That's my alma mater too. I love it. Now, Valerie has a holistic approach to patient care, and she is passionate about working in the outpatient oncology setting. So we appreciate you being here, Valerie. Alison Sturgill is with us, and Alison has been a registered dietitian since 2012. And she's also a board-certified specialist in oncology nutrition. She completed her bachelor's degree and dietetic internship and master's degree through Murray State University in Murray, Kentucky. Alison moved to Atlanta in 2013 and has worked with oncology patients who were admitted to the hospital for chemotherapy, bone marrow transplants, and side effects of their cancer care, etc. She's worked in that area since 2022. She's been working in the outpatient setting, providing nutrition care and education to patients receiving radiation therapy. ladies, we thought this would kind of be appropriate talking about diet and nutrition as we enter into the season of food. So we got a week to go for that. And then, we look forward to Christmas and the other holidays. And man, I tell you, so this is kind of top of mind for me. And I have a question, and either one of you can field this question. Like, when men hear prostate health, what do you wish they really understood from the start, especially around nutrition and lifestyle?
I'll take that question. I think the first thing when you think about that is not to fear food, because over any diagnosis, but especially when you talk about prostate health, I think people start to fear food and fear what's going into their bodies, and then maybe go from one extreme to the other. And rather than doing that, I would encourage men to take a step back and look at the bigger picture and say, sure, food is and nutrition is definitely one component, but what else can I change? Exercise, mental health, bone health, that will also impact my journey in a way that then everything else kind of falls into place and won't seem so severe or scary. And certainly nutrition is a big aspect of that, but then there's like all these other factors too that around lifestyle that should also be considered.
What about myths and misconceptions you encounter about nutrition and prostate cancer? You mentioned the fact that some men, was like, well, maybe I just shouldn't eat. What would I do? But are there some that, misconceptions of what men think they shouldn't do and what they should do? Have you all kind of run into any of that?
Yes, that is something we run into every day. The first thing is probably the most popular, the first one I'm going to mention, which is, and this is for all cancer patients, something that they hear from others when they first get diagnosed is that they need to avoid sugar because sugar feeds cancer. And that is so hard for so many patients because, like Valerie was saying, it can send them from one extreme to the next. And something that is extremely important during treatment is maintenance of weight because it can help with mitigation of a lot of side effects of treatment. There's a lot of reasons for that, but going from one extreme to the next can just make it so hard for patients to eat and get the nutrition that they need. So we like to address that myth first and foremost. Sugar feeds all cells in the body, so not just cancer cells, and it will not make cancer grow faster. So it's important not to completely avoid it. It's always good to limit added sugars, right? We know that added sugars aren't the best thing for us. So limiting those is important unless someone is struggling to eat at all. And then it's like, we just want you to eat what you can eat so your body is getting some form of nutrition. But that is probably the most common question that we get. And then I feel like especially in today's society, I feel like supplements have become a really big part. Most people are on them in some way, some form. And so I think I usually get the question of, is there one specific supplement that I should be taking that is going to help with prostate health? And the answer is unfortunately no. There's a limited amount of evidence for supplements and they're not well regulated. There's not a lot to say that what you're taking is exactly what it says it is. They do have some third-party testing now that's doing some quality assurance on certain ones. But I always tell people we want you to get those nutrients from your food first. So food first, and then if you are having some type of deficiency, then that's what we can look to supplements for. But there's not like one specific one that we recommend for any cancer patient or for prostate health.
A lot of our prostate patients are on ADT therapy, and we know that bone health is extremely important for that. So your physician is typically going to be monitoring your calcium and vitamin D, but I do have a lot of patients who are taking supplements to promote the bone health and make sure we're monitoring bone density as well. So that definitely is one that I probably see the most. But in the setting of the ADT therapy, it's warranted and something that is pretty closely monitored.
And when you say ADT, what does that stand for?
Androgen deprivation therapy, but we always just say hormone therapy.
Androgen deprivation. Thank you so much. See, I was talk to men and they always say, I got to have some pumpkin seeds and some, salt palmetto, that will keep the cancer away or that will keep my PSA down. Do y'all know, have you heard that or anything about those two supplements that kind of have been associated now with prostate health?
Yes, and Valerie, correct me if I'm wrong. I know there's some research that's been done on saw palmetto, but I don't believe it's enough to say, hey, this will definitely work to keep PSA lowered.
Correct. Yeah. Very low evidence. And also, I think saw palmetto comes with its own interactions. So before anything, we always recommend talking to the provider and just making sure that it's safe to take with all the other medications that maybe the patient is on.
Right. It's interesting because I was taking a supplement called NAC. It's something I can't remember, but I was taking it. It helps in your immune system. And I started taking it around COVID because I saw somebody say, oh, you need to take NAC. But I know when I talked to my doctor about it and they looked it up, and it was really not a good thing for me to take during my treatment. And that was the one thing that they said, you may not want to stop taking that. I never would have thought that one supplement would have maybe not be what I needed to take at the time. So I guess the main thing is, sometimes we know about the medicines that we're taking, right? The blood pressure and cholesterol and things that we're prescribed from a doctor. And we take supplements and sometimes we forget to mention the supplements that we're taking. So what you're saying is it really is important that you have that same list of medications, which include supplements when you're talking about treatment, right?
Yeah, it's always important to mention to your doctor because, like you mentioned, there are some, especially with radiation, that because they're high in antioxidants. And the thing with supplements is they're in such higher doses than what we find in foods, right? So there's some concern that they could protect the cancer cells from the treatment itself. And we want that treatment to work as well as it possibly can because you obviously just want to go through this the one time and be done with it. So yeah, always, always, always mention anything you're taking to your doctor and care team.
Does nutrition differ during active treatment compared to like long-term survivorship?
Yes, it does differ, and the type of treatment you're receiving makes a difference too. So, how Valerie was saying with the ADT, the hormone therapy, sometimes you need to take about vitamin D and a calcium supplement because bone loss is obviously something that we're concerned about. Those medications also tend to lead to weight gain. So you have to consider diet for that. Whereas radiation, which is what I typically am working patients that are getting radiation most often, things like the antioxidants we want to avoid. I know you were talking about the full bladder, so we make sure you have to stay really well hydrated. We make sure that you're not eating a lot of foods that can cause gas because where the prostate is located, if you have a lot of gas in your intestines, then that can shift things around and make it hard for you to get treatment, especially if you're receiving a targeted treatment or a targeted radiation like proton therapy or CyberKnife.
And so I'm on the other side, right, where I'm seeing patients during either chemotherapy in later stages, or if they're coming in for like Lupron injection, which the Lupron, just like the ADT, can also lead to some weight gain. So a lot of the patients will ask about healthy eating habits and what they should be doing. And I know we'll get into that a little bit later. But then the other side of that is other treatments that might cause side effects that inhibit the patient from eating. And then that's when we switch into weight maintenance, making sure their weight is stable, making sure patients are getting adequate calories and protein, and maybe not so restrictive to where they are able to maintain and get the nutrients that they need and helping treat side effects. But usually that's not until like late stage.
I read somewhere as we talk about weight gain, I know belly fat is just not good for anything. I was talking to somebody about it today. It was like, well, I don't know if it's connected to prostate health or not, but it's not connected to it's nothing good can come out of that. But I did read somewhere that it might be connected to prostate health. And is that the case? Or we're just talking about overall men's health as it relates to belly fat? And how can we kind of monitor that and really work on that without feeling overwhelmed when we're at home,
That's a really good question. And as we age, unfortunately, we do see that we tend to carry weight and gain weight in our abdomen and that fat tissue. And that's what can lead to a lot of chronic diseases, hypertension, poor blood sugar management, right? High cholesterol. And then if you're already on ADT, that can also lead to what we call metabolic syndrome, and that's like the development of all these chronic diseases, then it unfortunately, then you have to start managing those things. But there is a lot of evidence that shows to decrease prostate cancer risk, really have to be careful of those inflammatory foods that can lead to some of these chronic diseases. So, for instance, foods that are high in saturated fat. We know saturated fat can lead to a lot of these chronic conditions and cause increased cholesterol. And that's, we hold on to the fat in that area. And it also causes inflammation in our body. So really watching out for those foods and trying to limit the intake of foods that are high in saturated fat, trans fat, and also red and processed meats. Red meat especially can also lead to inflammation, and the added sugars, right? So that's also kind of where that recommendation is to limit the added sugars comes in, because added and processed sugars increase inflammation, increase hormone activity, and the circulating hormones can also lead to chronic diseases and conditions. So limiting all these things and promoting what we, call an anti-inflammatory diet is very beneficial to decrease the risk of prostate cancer. Now, I think your other question was, how is that attainable? Like, how can we make attainable changes?
And particularly with the holidays, all the comfort foods, everything approaching, we don't stand a chance.
No, it's hard. It's really hard, especially because I feel for me, the holidays are so centered around food, centered around family, and like we're all gathering and from sun up to sundown. Like I feel like we're just eating all the time and you want to enjoy it. And again, it kind of goes back to like, don't fear it, right? So like I would still encourage patients to eat what they like, but maybe, thinking about like portion control, right? Like using a smaller plate, or we talk about the plate method a lot as dietitians. And by the plate method, I mean, if you look at your plate and it's like a circle, you want half of that plate to be a fruit or a vegetable. And then a quarter of that plate would be a lean protein. And then the other quarter would be a whole grain. So if you're, first of all, using a smaller plate, you can help with portioning. And then if you try to like load up on all of the veggies and then you still get some of the whole grain and your lean protein, then that's going to help you with a more balanced plate to where you can maybe have like a little sweet treat on the side. Yeah. And then exercising, trying to like incorporate exercising somehow into your holiday, right? Whether that's taking a family walk, right? Or going to the park and throwing a football, or, trying to make it more active, because I feel like sometimes that's easier when you have like a buddy or somebody to do some activity with.
Yeah, take the dog on a longer walk, as opposed to right around the...
Exactly. Yeah. It's hard to find that motivation. Yeah. During the holidays. And you never know with the weather, especially here in Atlanta. It could be 80 degrees for all we know next week. Right. So getting outside, or maybe even going like, if you live close to Stone Mountain, go to Stone Mountain or do something outdoors. That can definitely help the physical activity aspect of the holidays, and not just like sitting around and around the fire.
And let me say something about the small plate, the guys. That doesn't mean put stuff on a small plate and then go back 3 or 4 times. My wife has sort of adopted that whole small plate thing, because I know in Europe they do that, right? So what I have to remember is what I try to do is not to go back for seconds. And I've been good about that. And even during the holidays, when I get what's on my plate, a little bit of everything, and to your point, a little bit more vegetables than some of the starches. And I know mac and cheese is a big deal, but I found that a little bit of everything, and you can satiate that hunger and don't go back for seconds. I mean, maybe that's the goal for everybody that's watching now. Don't go back for seconds during the holidays, because you got cake, you got sweet potato pie, you got a whole bunch of stuff, right, coming up next. So just kind of look forward to that. I know it's difficult. Alison, you got anything to add to that?
Yeah, I was just going to say 2 other quick, speaking to your not going back for seconds. I know a lot of people will say, oh, I'm waiting until we have our meal to eat. Like I'm not eating anything else the rest of the day. which I think then causes you to overeat when you eat the meal, because by that time you're starving, depending on what time your family eats. So trying to still keep to like a regular schedule to some degree and eating something before you actually go to the big meal so that you don't devour the big meal.
Yeah, there's a tendency, I think, particularly around Thanksgiving. I'm not going to have breakfast. I'm waiting for invariably there's always some issue where you think you're going to eat at 1 and then it's 2 and then it's 3 and then you're starving and then you can't wait to just dig in there. Anything else to add to that?
My other thing was also how Valerie said, save some room for like a sweet treat. Don't deprive yourself either, because going from one extreme to another, how we've talked about before, will just make it feel unattainable, saying like, I'm not ever going to get to have sweets again. I'm not going to get to enjoy this with my family. You know, we don't want people to be so restrictive that they're not enjoying themselves, because food still should be enjoyable, right? It's a big part of our lives. For so many of us, especially at Thanksgiving and Christmas and all the other holidays, it's social. So we want you to still be socializing and doing that in a way that's comfortable without overindulging.
Yeah, and feel bad about it. You shouldn't feel bad about it.
Yeah. And I would say too, that if you have someone, and this is really just in general, right? Sometimes it's a team effort, it's a family effort, just to kind of encourage the person or encourage each other, not to sort of overeat. My thing is, if you can get through this without picking up 5 pounds, you've done well. If you can kind of maintain at least where you are. But I will say, now some people are saying that I don't have to do any of that. I just got to take the shot. So my question is, with all of the Wegovys and Ozempics and everything out there, how does that fit now into a cancer-focused nutrition plan? Or does it? Or is it feasible to?
I think it's tough because you have to ask yourself, why do I want the shot? Why am I taking this, right? Because if you are obese and this will safely lead to a healthy weight loss, because there's such a thing as losing weight too fast, and if it's accompanied by weight-bearing activity to preserve muscle mass, I think it can be done in a very healthy way, and it can be very beneficial to patients to decrease the risk of not only comorbidities, but also some cancers that we know are driven by obesity. And so the issue with a lot of these is because the weight does come off very quickly, that the patients are losing fat, but also muscle, which we want to avoid. And then that makes it hard for them to tolerate various treatments, whether it's radiation or any sort of other treatment. It makes it really hard when you lose that muscle mass. It can also affect bone health, which we know also is very important. So I think if it's monitored and done in a safe way where patients are getting the protein that they need, the calories that they still need, and they're able to exercise through that and really work on strength training and weight-bearing activity, there's definitely a safe space for it and can be warranted if it's used for that method.
Are you all finding that to be the case where now patients that you're dealing with are either on it, thinking about it, and this is something that you have to address now, or you're not really seeing it much?
I'm certainly seeing it more often, especially typically I'm already seeing patients coming in who are already on it, more so than asking to go on it. And usually our physicians are pretty good with keeping them on it, as long as, again, avoiding significant weight loss, paying attention to their muscle mass, bone health, and also side effects, right? Like if we know that there's like a lot of GI side effects around the injection, so monitoring that as well. I don't know. What about you, Alison?
Yeah, I've been seeing it a lot more frequently. And like Valerie said, it's typically people coming in on it that they may have gotten started on it before their diagnosis, especially if they had diabetes. Sometimes we do have to stop it. Like Valerie said, if they're losing weight pretty significantly, because we don't want that during radiation, especially. But I haven't seen as many people here trying to get on it. Like she said, they're mostly already on it. And it can be a great tool for weight loss. I mean, weight loss is hard. So sometimes getting that little kickstart can be great, but like she said, doing it in a healthy way, because there is unhealthy weight loss, and losing your muscle to where you're fatigued and, losing your strength is no way to go. So it can be a great tool though, as long as it's paired with still focusing on a healthy diet.
Right. And it sounds to me that if you're thinking about doing it and you're going into treatment of whatever treatment you decided to do, it's probably better to wait to get through the treatment than to start something maybe I mean, just seems to me it make more sense to maybe I'll do this on the other end as opposed to starting right when I'm starting treatment for proton treatment or photon, whatever. Would you say that may be the better case just overall?
I think just discussing it with your doctor is probably the first step, just because it depends on whether the benefits outweigh the risks, right? Like there may be a really good reason that somebody needs to do it quickly or now, and then they may be okay to wait though until after treatment, and the doctor may prefer that.
So talk to your doctor. See, that's important. All right. So now let's get off of the shot and things that we can do to bypass some of this stuff and talk about what we can do. Small habits. What small habits can create the best long-term benefits, particularly when we're going through treatment for prostate cancer?
Yeah, so like Valerie said, little things like starting to use a smaller plate, right? If you're trying to cut back on portions or prevent weight gain. I always tell people too, it can be overwhelming if you're trying to do a diet change to kind of change everything all at once, right? So if, say, your diet is really high in saturated fats, we talked about how we know that that's not great for us. So starting with just cutting out maybe like one or two things that you normally drink or eat that are really high in those things. For instance, like if someone drinks a lot of whole milk, that's really high in saturated fat. So starting with just decreasing that down to 1% milk if they can, and cutting back on the amount they're drinking. Little things like that. If we're not exercising, because exercise is so important for so many things. I think number one, obviously, it helps us feel stronger, helps with cardiovascular health, controlling blood sugar, but also I think I find too, especially just for me, if I exercise, I don't have as many of the cravings for the foods that are like high in sugar, high in fat. You get your body moving and you just feel better. So if you're not exercising, starting small, right? Like adding in a 10-minute walk initially a day, and kind of increasing it each week, right? Like going up to 30 minutes and starting with walking and then kind of increasing to something else that's maybe a little bit more strenuous. But really just starting small and not feeling like you have to do it all at one time, I think is the most important thing. And also just patience, especially if you're trying to lose weight, because it can be a slow process. And I know it's hard for all of us. If you want to lose weight, you're like, oh, I want it gone by tomorrow, but it takes time. So I think sometimes to not focusing on the amount of weight you've either lost or what you weigh, but focusing on how you feel, right? So increasing activity to where you start to notice, like, I'm feeling stronger. I'm feeling like I'm not as hungry for these foods that I was eating before. I think sometimes that's a better place to start than looking at the metrics immediately.
Yeah, some people say don't get on the scale right away. I mean, don't do that every day or every other day or every week. And, your weight goes up and down. So I have to ask you, as we said, real tip here, on the real, I guess, I have a millennial son, so I'm trying to, I'm trying to stay relevant. How frustrating is it? What you both are doing is just so important. But I just know that, man, in particular, we are so hard-headed. Everything you're saying, I'm like, yeah, I got to do it. I need to do it. And then we just sort of don't. And I know you have success stories, I'm sure, but how frustrating, to really get someone to get this. That's why we're doing this podcast, because we really want to drive home how important it is and what you can do to better your situation as you go through this prostate cancer journey. How do you get past that, knowing that we just hard-headed? We hear it, and I know y'all, the guys are sitting there glazed over going, yeah, okay, you give them a recipe and you give them a list of things, and then they go home and, eat potato chips and drink a beer. So yeah, just on a personal tip, what motivates you to kind of like, got to keep doing this, got to keep pushing this?
I think one of the things that's like really good about the outpatient setting too is we have this space to like really provide individualized care, because Alison said this, and I believe, everyone is their own person. Everyone is an individual. We're all different. Every person is going through a different journey. So yes, you have prostate cancer, but no prostate cancer is created equal. So I think finding what works individually for every patient of ours is key. I feel like I'm a little detective sometimes, because I get to like figure out what's going on and what their habits are and what their interests are and like what makes them tick, to then hopefully give them the tools to make a change, or how they learn, right? Because all learning styles are different. And like, do I give you a handout? Do you you give me a food log and I tell you what I feel like you can tweak a little, right, with that food log, because maybe men are a little stubborn. I don't know. But I think also if you've been doing something for so many years, it's so hard to change habits for anyone, right? For any adult, it's really hard. I think the food is medicine approach also helps a lot, because I think food is medicine. Like what we put in our bodies will either benefit us or hurt us in the end, right? So I think that approach sometimes is helpful to some patients with a little tough love. I think having support is really beneficial if you have that support either from family or friends, because if you have people asking you, hey, I want to cook for you or I want to make you something, you have the power to say, okay, great, but can you maybe make me something that has less fat? Or, I want to try a meatless Monday, so maybe leave out the meat. Or, I think down south too, it's kind of hard because a lot of people cook maybe with a little extra fat, with a little extra love, right? Which in moderation, great, but that's hard to change sometimes, right? So saying, okay, well, how can maybe I make this recipe, but like tweak it in a way that, again, is going to have a little bit less fat or a little bit less sugar, but still taste good, because that is possible. Eating healthy doesn't necessarily mean it's not going to taste as good. It may not taste the same, but it still can taste good.
Yeah. And it's funny because I've been in family reunions where I don't pork, but I was one time I couldn't eat. The only thing I could have was the salad, I think, because everything had pork in it. And the corn, everyone was like, does that have pork in it? Yeah. Does that have pork in it? Sure it does. I'm like, oh, okay. I just have the salad and a piece of bread. But then they said, oh, we cooked that with lard. So it's just
No escaping it. Yeah.
All right. So Valerie, this question is for you. When it comes to some of our daily nutrition habits, and it's what I like to call the 3 C's, caffeine, cocktails, and cannabis, how do these little C's affect the big C that we're dealing with?
Great question. Definitely one that we get often as well. So let's break it down into each C. So coffee. The biggest recommendation is making sure, number one, you're hydrating, because especially coffee that has caffeine can sometimes lead to dehydration. So as long as there's no major heart issues, there's no reason why you can't drink coffee. I know that during radiation, they want to decrease anything that can cause gas, and sometimes caffeine can cause gas. So the limit is 16 ounces or 2 cups a day, and really decreasing any liquid that can decrease gas, such as like carbonation. There's also a concern if you're drinking coffee that you use creamer. So the recommendation is to avoid a high fat creamer, because the fat can increase inflammation, and we just want a less inflammatory environment. So choosing a lower fat creamer is preferred.
Let me just ask a question on this, the hydration tip here. I guess, too, if you're taking blood pressure medication and it contains a diuretic, which, makes you go to the restroom, gets the water off and that kind of thing, I guess it would be even more critical for you maybe to limit your coffee intake.
Right. Or maybe like if you really want that coffee and you want, maybe your first cap will be normal cup of coffee. And then if you don't mind switching to a decaf, then that can definitely help with that, because then hopefully you're not going to the bathroom as often, because definitely you need to replace what you're losing. Yep. So the next one, cocktails. The evidence is actually quite limited on how alcohol may affect risk of getting prostate cancer. There is some suggestion that a high intake of alcohol might increase high-grade prostate cancer, and the high grade is typically a high Gleason score, and that may also lead to progression as well. So the limit for men is 2 servings of alcohol a day, and that doesn't mean like, okay, I'm not going to drink every day, so I get whatever 2 times 7 is, right? So I get 14 drinks in that one day. So the limit is 2 a day, and that's a serving. So a serving of wine is going to differ from a serving of beer. And what I always tell my patients is to also make sure you're having food, so not drinking on an empty stomach, and also hydrating. So for every serving of alcohol, you want to have at least 8 ounces of water. And actually same with the coffee as well. So for every cup of coffee, drink a cup of water.
But I guess it would be best if you could reframe especially during treatment. I know I didn't really take, I drank here and there, maybe a beer here or a cocktail there, but I just pretty much reframed during the treatment, and then moderately afterwards.
Moderate consumption, and that's where the 2 comes in, the 2 servings comes in. And of course, I always recommend my patients discuss it with their oncologist, right? Just to make sure that it's safe to consume, and especially during treatment. And cannabis, right? So this is emerging. This is a new area that we're slowly finding more and more about. And there is actually some research that shows cannabis use may actually decrease the risk of prostate cancer, and it may also slow progression of prostate cancer, but this data is very limited. Because of that, for pre-treatment, the risk of prostate cancer, it's one of those things where, again, you might want to consult your physician. They're finding that during treatment, cannabis can be beneficial for symptom management in tandem with their medical treatment. But with that, like with any medication, cannabis has its own side effects, such as drowsiness, dizziness, change in mood. So you always have to ask yourself, what is the benefit of the cannabis, and does it outweigh the side effects, risks of cannabis? And if the benefits outweigh the risks, then if your oncologist is okay with you using it, then it can really help with treatment side effects in a controlled setting.
Is it different for, say, a radiation treatment regimen that you're going through versus, say, hormone therapy?
It depends on the side effects that you're experiencing, right? A lot of the radiation side effects I feel like are more GI side effects. So if you are having maybe pain related to that, the cannabis can help with pain. Whereas with the hormone therapy, those side effects I feel our patients are seeing more weight gain or mood changes, and not too sure on how cannabis can help or hurt that. And especially because it is new and emerging, certainly I feel, especially our palliative care team, if your cancer center has a palliative care doctor who's able to kind of walk through the uses of cannabis and maybe their benefit or something like that, I think that is also very helpful.
I've been reading a lot, hearing a lot about the use of cannabis specifically for palliative care. That seems to be something that's becoming more of the norm than the fringe. Now, I didn't mention any other kind of drugs because at the end of the day, in the words of Whitney Houston, crack is whack. So I didn't go down that road. But I do know that there's a lot of information out there about the 3 C's, if you will. And thank you for giving us some insight on that. I think that'll be very helpful. Now, I have a couple more questions. One is, you mentioned support system, but what about a single guy? We address that a lot on this podcast. I mean, as it pertains to support, as it pertains to treatment, oftentimes we talk about the support system, significant other that's around that can help and motivate. So what about single men that, really don't have a support system? Maybe they really don't cook a lot, but they eat out a lot. How do you address that?
Yeah, it can be very hard for patients that don't have the support system, just because it is so much easier when you have someone helping you do it, right? Sometimes when you're having to figure it out all on your own, that can feel really overwhelming and stressful, especially if you're someone who hasn't cooked a lot and has eaten out more. And we know that unfortunately eating out, most of those things are just going to be worse for us than if we cooked them ourselves. But thankfully, there are a lot of more resources than there used to be. There are so many meal delivery services, and these services that send you the ingredients for things and talk about how to cook them. I had a patient the other day who was just learning how to cook. He's like, I've never really cooked, but I'm on this journey to start eating healthier. We were talking about just trying very basic recipes at first, right? Things that only needed a couple ingredients, and you can maybe put it in the oven, put it on a sheet pan. And I think that's where Valerie talked about sometimes she feels like a detective. We kind of are. We're like, what do you feel comfortable doing? We have to kind of figure out what works for that patient, because everyone is so different. And some people are also just so busy with working lots of hours. And then when they're in treatment, if they're working and receiving treatment, there leaves very little time in the day to focus on meals. So seeing what a patient's situation is, what they safe or comfortable with, and trying to find resources for them where we can is something that we try to help with as much as we can.
It's funny because when I see the commercials about food that comes, already like sorted out and measured, and all you got to do is like put it in the wok or put it in the pan. And I laugh about, my wife and I were like, wow, these millennials and, Gen Zers, they just, don't know how to cook. But if you're single and if you're busy and you can order something where you can have it fresh, right, and have the ingredients that really help you, it makes a lot of sense. So I'm now a believer in ordering your meals that way, because I could see that working.
It's very helpful. Yeah. I mean, even I do it just for myself because I'm busy and I talk to people about food all day. The last thing I want to do is sometimes figure out what I'm going to eat. So if it's already at my house, then I just have to cook it.
And I would think meal prepping too would help if you cook and you're single, or even if you're, you have someone in the house, meal prepping. My son and his wife, they do that beginning of the week. They meal prep for the week, and that helps too, I would imagine, right?
Yeah, I think you have to be really regimented to do that and really like plan ahead, because with meal planning, you have to know, okay, like I need this, and that sometimes really helps people. Also, frozen meals have come a long way, right? We're past the like hungry man dinners. We've come a long, long way. There's even like local frozen meal options that are cultivated by a dietitian, and there's vegan friendly, high protein options, diabetic friendly options. So it's really nice now because you can really find them like tailored to what you need, and truly using like your dietitian. Like if you have a dietitian in your clinic and you're just kind of like, well, I don't know what, or I just like need ideas, well, just ask your dietitian. We probably have a list for that, or like a handout for that we can give you to kind of guide you at the grocery store and at least help kickstart, your journey.
Your journey down the healthy eating and healthy living. So as we close out, what are the top actions you want men to take away from this? The kind of the non-negotiables, if you will, particularly as we're getting into the holiday season, and those that are going through treatment, those that are thinking, kind of deciding on what treatment they're going to use, everybody from the beginning to the middle to the end. What are the takeaways you want men to figure out here?
I would say one of my biggest takeaways is, one of the things I want people to consider is that, kind of like Valerie said, not all prostate cancer is created equal. So really, meeting with a doctor and sitting down and discussing your options and what's best for your diagnosis, but also considering diet-wise what's best for your diagnosis, right? How we've discussed that different treatments, you might need different things. And then I would say from there, just encouraging people to go easy on themselves, right? Because I think a lot of times when people get diagnosed, they're kind of like, what did I do wrong? And it's really just not that simple, because like you said, it's so like all of the things that can lead to cancer and prostate cancer, especially, it's much more complicated than you ate the wrong thing or you did the wrong thing. There's so much about cancer we just don't understand. So going easy on yourself, and if you're wanting to make big lifestyle changes, taking the time to do that, not feeling like you have to do it overnight. Just give yourself some grace.
Yep. And I just want to say also knowing what resources you have and what's available through the whole journey, right? Because you don't have to feel like you're in it by yourself, and that even if you might be single, you still have support from the clinic and other resources. And if there's like social support and like talking to a social worker, because mental health is so important. And that's such a big component of diagnosis. What sources are available for exercise, right? Like there's programs through the YMCA available to patients, right? Things like that. Of course, dietitians, making sure you know how to like get in contact with your support staff, essentially, I think also is really important, because sometimes I feel like patients don't even know they have these like resources available to them. And then support groups, I think, are great, and being involved in those and being able to like access those like types of support groups.
Yeah, I would say wherever you're getting your treatment or wherever you're going through this journey, to seek out or what's available, particularly as you talk about nutrition, and ask if they have a nutritionist on staff. And if not, where can I go to? I mean, that's a part of the journey. I think, we tend to focus so much on treatment. That's the big thing on our mind. Once we're diagnosed, it's like, okay, what do I do? do I do active surveillance? And then after that, do I do seeds or, like brachytherapy or proton therapy or whatever? We really focus so much on that and we jump into that, right? And we don't really, just from, my experience, we don't really think about that healthy part of it. We just want to get through whatever it is to get the cancer out of us. But I think it's so important that you look even before you start treatment to start thinking about nutrition and to start thinking about lifestyle changes, definitely during and even after, because, like I said, when I finished my proton therapy, my mantra was, okay, I've done my part. You all have done your part with getting this back down to undetectable level. What can I do now on my part? And a lot of that centers around nutrition and really being active in making those choices. It's hard. I'm going to tell you, it's hard, but I would think as we enter the holiday, maybe this is the time to stop and say, this holiday season, I'm going to do it differently. Either you're going through treatment or you're thinking about it. And hopefully what you've shared with us. Now, I will ask if you all have specific resources that we can share. We can send that to our producer, Danny, and we can make sure that those links are in our show notes that will be a part of this episode. So we would love to have any kind of information that we can share going forward. Would be helpful. But yeah, anything else you'd like to share before we say goodbye to you this evening?
2 resources off the top of my head. AICR.org, great, very patient-friendly. They have a great nutrition section, lots of recipes, and it's research-based, evidence-based, so great resource, AICR.org. And the Prostate Cancer Foundation, wonderful website, great nutrition section. They have great articles, and you can, as a patient, download their diet guide, which I think does a really good summary of all of our recommendations, do's, don'ts, exercise tips. It's like an overall really good nutrition lifestyle guide specifically tailored for prostate cancer.
Yeah, and then one other one, there is a dietetic practice group through the Academy of Nutrition and Dietetics. It's just specifically for oncology nutrition. And on the website, I believe you can even look up dietitians in your area that specialize in oncology nutrition. I'm sure not every person from every center is listed there, but sometimes it's a good place to start. And also asking your center if they have a dietitian on staff. But I do not remember the name of the website link off the top of my head, but I can send it to you.
Well, Valerie and Alison, thank you so much for being a part of this particular episode. I know it really helped me, and I'm going to make it. This is my goal to get through. First, I'm starting with a small plate so I can enjoy my sweet potato pie and have room. And just kind of stay focused, because that's the important part. And just knowing that staying healthy during this journey is tantamount. So I appreciate you being here. Have a wonderful Thanksgiving and holiday season. And as I always tell people, don't eat too much turkey. So thank you so much. Yes.
No, I have to say, eat the rainbow. Don't make your plate one color. Eat the rainbow. I have to put that in there. I will be mad at myself if I didn't say that.
Eat the rainbow. I love that. I love that. Yeah. Thank you so much, Valerie and Alison, for joining us on this episode of If You Are My Brothers podcast and sharing information that we really can turn into what we like to call health action. I want to thank everyone for sharing your comments and your questions. We will be getting to them. We're going to make sure that our guests get any information that you're seeking so they can reach out to you. And we hope that this information was helpful that we provided. And it's always our goal to support others with similar questions and inquiries. So when you're watching, when you listen, always share. And as I mentioned from the start of the show, that we are definitely in this together, no doubt about it. Now, if this episode resonated with you, we ask you to share it, as I just mentioned, like it and subscribe. You can connect with us via email, social media, and even traditional mail through the postal service. And you can also listen to past episodes at ifyouaremybrothers.org. That's our website, ifyouaremybrothers.org. And While you're there, sign up for our e-newsletter that comes out every 2 months. So we've got the November, December edition coming out in a couple of weeks. We want to remind you that If You Are My Brothers is a nonprofit 501c3 project dedicated to prostate cancer awareness and health action. And we hope you will support us in what we do. Now, we're going to ask Danny to put that all-important slide up with options for giving. And if you're listening on our podcast, the link will be in our show notes. Now, when you make a contribution, you will receive your very own If You Are My Brothers commemorative mug. Thanks to the folks at Atlanta Brand Central. They've donated these mugs. You can see it. We have one in black and white, but this one's in color. So we want to send that out to you as a thank you, and you can put your favorite beverage in that. Hopefully it's tea and water, right? You can also enter into a drawing that we have for a chance for you to win an original painting of what we call our Everyman logo. It was done by renowned artist Cecil Bernard, an original oil painting. Now, we're going to be drawing for that. Anybody that signs up for the newsletter, or if you make a contribution, or if you just contact us, we'll make sure that your name's in the hopper, and we'll be drawing for that at the end of December. Additionally, all episodes are archived on our YouTube channel as well. Now, special thanks to our producer, Danny Garcia Pozo, who's pressing the buttons and making all the stuff you see happen. Also to Zach Reynolds at Borkhouse Productions for our opening. And remember that this podcast is not a replacement for your medical advice. Always confer with your healthcare provider about your health. Now, next episode. We've got our next episode coming up Thursday, December 4th at 7 p.m. Eastern, as we talk about beyond the beam, what radiation really means for patients and the different approaches to radiation therapy. We have a series of programs that we're doing within the podcast where we're going to really look at all of the various treatments, from radiation therapy to even active surveillance to prostatectomy, having your prostate removed. So we're going to really dig deep into all of the different treatments so that you can go back and maybe listen to the different episodes as if you're going through that treatment decision. And I can tell you've been there, done that. It is something that you want to have as much information as possible. And so we're going to discuss that, and hopefully you'll be able to join us. If You Are My Brothers is a project of Straight Street Media. You can learn more about Straight Street Media at straightstreetmedia.org. And it is a 501c3 organization. So until next time, as we always say, if you are my brothers, you will share this message. Take care, stay healthy, have a wonderful, wonderful Thanksgiving as we enter into the holiday season. We appreciate you. We love you. We're here for you. And reach out to us at any time, and we'll see you next time. Peace.